It's time. Woo! Welcome everybody to another exciting day of Nurses Week. I'm here with Mark. What's up, Mark?
How are you, Richard?
Buddy, as you can tell, man, it's high noon here in the East Coast, man, and I'm having fun. And I got you on the show today, and we're going to deep dive into 30 years of nursing. Am I right?
30 years of nursing. Yes, sir. Going on 30. Actually, just going to be 31 next month.
Ooh, look at you, man. You're a veteran at this, man. So where are you from, Mark? I don't even know.
Actually from Kentucky originally. That's where we're actually based as well.
Kentucky, Derby and bourbon, right? Derby and bourbon is what I think about.
Derby, bourbon, and basketball. You can't leave out basketball.
Oh, that's right. UK. Are you a Wildcat or are you a Cardinal?
Go Cats. No, definitely no Cardinals.
There we go, right there. All Cardinal fans out there, send Mark an email after this, man. But hey, Mark, I tell you what, this is a great week, man, to celebrate. I'm so excited here. You know, we've been rocking this out the last couple of days, and I'm excited to have you on the show here. I just want to talk about, deep diving into nursing because take us back to when you began nursing because it's changed over the years. Let's take us back 30 years ago. Give us a little story of where you've been, and then we'll start where we're at now.
Sure. Yeah, 31 years ago. So 31 years ago, I started as a new grad here in Kentucky, University of Kentucky. Had the opportunity to work fresh out of school in a trauma ICU. Blessed to work with some amazing docs and nurses and clinicians. Taught me how to be a great nurse. Worked with them for several years. Got really super interested in transportation and getting patients from small towns to big towns and to the big hospitals where they needed to be. And so got bit by the air medical bug and got the opportunity to be a flight nurse for a few years, both in the Atlanta, Georgia area and here in Kentucky.
Oh, wow. Okay, so time out. I live here in West Virginia now, and I see, it's the helicopters go, it's hospitals right here, WVU Medicine, and I see it all the time. Like, it seems like they fly like every hour. Like so give me a little story about that because that had to be like, whew, you had to be on your toes on that because every time you're going to fly somewhere, it's like an emergency. Am I right?
Absolutely. Absolutely. A friend of mine always said it was hair, teeth, and eyeballs. That it was just, you were going to some of the worst things that have happened in somebody's life. And your whole goal is to get them where they need to be, hopefully to save that life. So yeah, we flew in, I've done a lot of trauma type of flights. We've done hospital to hospital. We've done hearts and kids and high risk OB and all of those types of things. And so just been blessed to be able to be a part of that with, you want to talk about the people who are at the top level of their skill, paramedics, nurses, physicians, respiratory therapists, all those folks that fly, some amazing clinicians, just at the top of their skill level. It was just awesome to be able to take part with that over the years.
Hey, Mark, did that affect you any at all when you because when you're flying that helicopter and you're landing, there could be people dead, or you could see all kind of different things that, maybe down in your hands. I hate to say it that way, but it's like, every day's a different day. Does it affect you when you go home? I got to ask you that.
Sure. No, that's a great question. And absolutely 100%. I'd be in denial if I didn't say yes. It does affect you. We do a lot of work around that in the air medical industry. They do a lot of work around mental health awareness and trying to make sure to build each other up and debrief. We called it a debriefing after each flight. But man, it did take it home sometimes. And thankfully, my wife's a nurse, so she gets it. Now, she didn't want to hear all the blood and the guts part. She's an OB nurse and labor and delivery and an awesome nurse. But she would say, okay, just tell me the highlights. Don't give me all the gore because I don't want to do all of that. But having a wife at home that understood and having great coworkers, absolutely, that's how you process through it because you do see some really bad stuff.
What made you do that? I'm just curious, like to jump on a helicopter and do that. Was that like something that was one of your in the nursing? Because I realize now, talking to all these nurses, there's so many avenues. You don't just have to be bedside. You have numerous opportunities, even in staffing where you're at now. But what made you just jump in and say, hey, I'm going to jump in a helicopter and save lives?
Yeah, no, I'm glad you asked that. That's a great point because nursing is so broad. You can do anything in nursing. But back then I was surrounded by, I was in a big university teaching hospital. And so you see the different flight programs that are bringing patients in. And you looked up to them as a newer nurse in my first few years of practice, looked up to the nurses and the medics that were flying in, and man, they would bring in those terrible patients and they kept them alive until they could get them to us and to the operating room or to the unit. And just to see them, how put together they were. And I mean, it's 100 degrees outside and they're flying and it's a horrible day.
Ooh.
And they've got a terrible, terrible patient that they've brought in, but they are put together. And just to see that, it was like, man, I want to be like that someday. I want to be a fantastic nurse. I want to work with, people that are at the top level of their skill. And so I just kind of went after that, honestly, and had great people that mentored me into that role, and invested in me over the years, and just said, man, you can do it. And that's kind of how once you get the opportunity to kind of go as a visitor, or what we call a ride along, so got to fly along and see what it was like. And you don't get to touch the patient. You're just there as an observer. But man, once you do it, it's like, I guess it's either you definitely don't want to do it, or how could you not do it?
It's like a rush, right? Am I like the adrenaline rush? Like when you get there, it's like it's go time. I mean, it's probably I can't even describe it.
It is, and you've got times where like it's an adrenaline rush, and times where it's not. But man, it's number one, it's beautiful. Like you get to see everything. I mean, you're flying over tops of big cities, rural areas. Spring and when everything's in bloom, fall when everything's in color. It's just a beautiful job, to be able to do that, even without a patient on board. But then, getting to work with the people that you get to work with. So yeah, I just got blessed enough to be able to do that. Moved to Georgia from Kentucky to do that for a few years to start out, before I came back to Kentucky and did it for a few more years.
Is there a big, like when you do that kind of stuff, like you're flying, like, can you do that for like 20 years, or is it like more like, 5 years and then people will just skip into another, opportunity?
Sure. No, I think it's changed over the years. Honestly, I think years ago, I think it was a career level decision. I knew people who started at 3, 4, 5, 6 years, and then they got into that job and they stayed in it till they retired, because you couldn't beat them off with a stick. It was such an amazing job with amazing people. But I do think, because nowadays more so than not, there's so many that get into it and they decide they want to go back to school, because they are functioning at the highest level that they can in their practice. So there's a lot of that go back to school, be nurse practitioners or medics that go to nursing school. So you really see a fluctuation, in my opinion, of a lot. Some of them will do it for still career type lengths, but then some will, do it for several years and then hop out and, change their practice and advance their skill level and do something different.
That's awesome. Okay, so you did that. Then where did you go from there?
Well, from there, I went back into the hospital. Wanted to stay on the ground. Had some small kids. Wanted a more regular schedule, and so went back into the hospital and got actually into leadership. Started working with some nursing leadership positions, managing departments in the hospital. Got the opportunity to work with some great physicians and manage what they call in the hospital setting service lines, and so like a pulmonary service line or a cardiac service line for the whole hospital. And so kind of moving into those types of roles in my latter years in leadership before coming into this role.
Okay, so let's just shift into before COVID, because this is all before COVID. So, take me through the COVID years, because I mean, that was kind of tough. I mean, you tell me your side of it, man, because what I see sitting there and watching on TV, I was like, oh my, I mean, these nurses are like, 24/7. I have friends that said they worked for like 100 hours a week. I mean, it was like unlimited. They just needed nurses to show up and help patients.
Right. No, it was tough. It was very tough. I was working in a university teaching hospital at the time, managing a couple of departments. One of those departments that I managed was a procedural department. So you can imagine everything shut down during COVID and they were only doing emergency procedures. Well, that department did emergency procedures. And so you have people coming in the door and everybody's freaking out and scared, because what if they have COVID on those early days, like when we just didn't know what we didn't know. But I was fortunate. I had an amazing boss at the time, and she happened to be over not just my areas, but also infection prevention. And so she knew everything about COVID pretty much before everybody else did. So she, poured into us as leaders, and we got to then pour into our teams and help them to be more comfortable with it. But then like in the inpatient side, we're taking care of patients on ECMO, or have come off of ECMO, and they may have had an artificial heart, or they may have had transplants. And how do you have a heart or a lung transplant? And there's COVID, that's a danger. Like you're really freaked out and scared as a patient, But our staff, honestly, because you bond with those patients a lot and you see them so often, they're like your family, and their families are your family. Well, then COVID all of a sudden comes around and they're scared to death, because what happens if I catch COVID and my transplant already puts me at risk because I'm on all these immunosuppressants trying to make sure I get to keep my organs.
Yeah.
So it was really tough trying to take care of the staff who were taking care of the patient. I heard earlier this week, the folks from Lucid, when she was on and she was talking about being a clinician, and she and I have talked before,
Mm-hmm.
the role of a nursing leader, it's the toughest job in the hospital, is one of the things I say, is you're sandwiched between taking care of your staff who really need you and also taking care of the things you have to take care of for the hospital leaders. And you're sandwiched right in the middle. But man, COVID put you right in the middle of that. And it was a squeeze, because you have to take care of your team. You got to make sure their mental health is good. You've got to make sure they're not working too many hours. Are they running the risk of taking something home to their family? There's all of those factors that are in there. So as a leader, you have to be thinking about that for yourself and your family. I had kids and a wife at home, but then I've also got to make sure that my folks, are healthy and safe to take care of patients too. So it was tough, really tough. But again, the facility I worked for, we saw, some of the worst in Kentucky and the surrounding states would come, but we had some amazing people, amazing clinicians, leadership that were fully invested. And I mean, we had a command center that was open for weeks and weeks and weeks, with senior level hospital leaders that were there 24/7 to be a support to me as department leader, but also that would give us the tools we needed to be able to support the bedside teams, which was critical during COVID.
I got to tell you, man, that had to be so stressful. Them, whatever it was, 16 months or whatever. I mean, or 2 years on your family, because, I mean, I'm sure every day you go in the back of your mind, you're thinking, I hope I don't catch this. I mean, am I right?
Right.
I mean, you're walking in saying, I got to save lives, but I also got to save my life too.
Sure. I mean, I've heard people stripping in their garage, taking their clothes off in their garage before they go in the house because they don't want to carry dirty clothes into their family. I did that a few times. Looking at, we took care of transplant patients. And so you have to gown and glove and do all of these things to make sure to keep them safe on a normal day. And then you add COVID to the mixture, and then the nurses were scared. Like, what do we do? And so, I remember going in at 10, 11, 12 at night when, nurses are having a really tough time, and you just said, you know what, I'll be there in 30 minutes and go in and support them and walk with them through that, help them, go in the room and gown and glove with them, take care of patients. That's one of the things I'll say as a nursing leader. Man, I'm invested clinically. I'm a nursing leader, but I'll still jump in and get in the middle of the floor and help you take care of a patient. That's what you call a good nursing leader. And that's what was key in getting us through COVID, is really supporting the people taking care of the patients.
Was there any mental health counseling involved during the COVID time, or do you guys didn't have time for that? Because they're taking this home. I mean, nursing's a stressful career, it's like almost like a police officer and everything else. I mean, it's stressful. Was there anything for them to talk to or cope with?
Yeah, the facility that I worked in at the time, there were some resources there. You've got employee assistance programs, really mental health, honestly, that it came out on the front burner, because they were saying, spend as much time with your teams, let them debrief. We would have what I call a daily stand up, where you would get your team together and you would have a conversation on a normal day before COVID. And you would have conversations about what your day looked like. What's the news? Let me dispel any myths, rumors, anything that I can. But man, when it hit COVID, my assistant manager and she took the night shift, I took the day shift. We met with the teams twice a day, because information was changing that fast on those earlier months. You wanted to make sure that they had the most up-to-date information. That actually was the tool in their tool belt. It made them feel more comfortable and confident taking care of people, and hopefully eased some of the mental health burdens that it could cause. But no, we did have a lot of conversations. Hey, come in here, close the door. It's okay to cry. It's okay to have these conversations. Do you need a referral to EAP? Is there something that we can do for you to kind of help you out? So yeah, absolutely. That was a big focus during especially those first 6 months to 9 months.
I could imagine. And okay, so now let's tie into the post-COVID, you know what I mean, from now, because nursing, you know what, let's even go back. Since it's 30 years, I want to talk about this. How's it changed over the years? I mean, you're in management and all that, of course, now in the staffing side, but like, I mean, we didn't have the computers back when you started. I mean, what kind of computer was going on? I'm not dating you, brother, but you know what I mean? It was like, was there a lot more filing cabinets and locks on them with their, you know, the patient's all their information? It wasn't on a database at that time. I'm all joking aside, like, how's it changed over the last 30 years? I
Yeah,
mean,
makes me feel really old.
I'm sorry, Mark. I had to throw it out there.
No,
We're
it's
the same
okay.
age anyway, probably. So
It's okay. No, you're right. When I started as a new nurse, I remember email was just beginning to be a thing, and your computer at work was like DOS. It looked like DOS. It was a black screen, green writing.
oh,
There was no window. Like, I don't remember any of that. We documented everything on paper, and starting out in a trauma unit, we had a clipboard that was the size of like 4 clipboards, and then you had a flow sheet that was 4-fold, and it literally opened all the way up on the whole clipboard, and then you had to flip it over. So you had all that documentation that you can imagine now goes into the computer, had to go out on paper. So yeah, lots of file cabinets, paper doctor orders, handwritten orders. You're trying to read a physician's writing, it's like, not easy
oh
sometimes.
yeah.
It's a running joke, but I got really good at it over the years. Being a nurse, you have to. So, but yeah, it's changed so much. Electronic healthcare record, there's good about it. It takes a lot of time. So sometimes that's time that, a lot of nurses I hear say, that's time away from the bedside, that I'm having to spend putting things in the computer. So some of them that do a really great job at it, spend a lot more time in the room, on the computer in the room, and you're doing your documentation and you're visiting with your patient and trying to find ways to make it work. That's changed a lot. Technology's changed so much.
Oh, I could imagine. You know what's funny is, real quick, Mark, not to interrupt you, but like, it's like I go in, I have the app now. So, I can see everything, and I get a blood test, everything pops up within a day. The nurse comes in, they type in your information. Everything's there for the last 10 years, you know what I mean? In the system. I mean, I got to tell you, that's something I love. Like the apps on your phone, you know if you're going to live or die right there.
Right. Well, and that's part of the issue with electronic records, right? I remember when those did kind of first come out, the research has gone out, or there's been a lot of work saying that basically in healthcare that you'll go through one very large thing like an electronic healthcare record implementation in your career. Because it's a big deal when they go through that. I've been through 3 with different facilities.
I bet your files are everywhere, right? When that goes in, anytime you implement something,
everywhere, but
nothing ever goes 100% right.
Absolutely. And you have to spend a ton of time on that to make it work. And but for the staff, absolutely, it can be stressful. It's super important to keep up with technology. It does help. When I can get my lab results, like you said, I get my lab results. Sometimes I've looked at them before my doctor looks at them. And I've had questions, and you've got to wait for that call. So hopefully you don't have a patient that, somebody uploads a lab that they're really scared about or they're concerned about. Hopefully that, they're catching that and somebody's reaching out to them before they read it. But yeah, technology is good, but you also have to mediate it a little bit, make sure that it's not creating issues as well.
I know it's pretty wild. Okay, so now let's steer to post-COVID now. So I mean, what are you seeing like right now? I mean, after COVID with the hospitals. I mean, I know, and we're going to deep dive into the recruiting, of course, too. There's a nurse shortage out there. We've been talking about that all week there. What is going on, Mark? I mean, why aren't the Gen Zs, or what's the next group coming in, not jumping into nursing these days?
Sure. Yeah, it's the nursing population. We've said the human population's all older, right? We've got those older folks, baby boomers, but a large population of nurses that are older and just deciding they're getting out of it. There is a lot of mental health issues, the mental stress of being in the positions, the physical stress of being on your feet, long hours of the day. So a lot of folks do decide to get out of it when they can, when they're older. Honestly, I mean, concrete floors, it used to be years ago, you could do 8-hour shifts, 12-hour shifts. Most places nowadays, I mean, you've got a few that are doing it a little differently, but most are 12 hours. When you get to be your 40s, your 50s, maybe over, you may still want to be a nurse. You'd love to still do it, but man, can you make it 12 hours? Because it's tough. It's a grind sometimes. So I think in looking at that piece, that's one. So we want to keep the nurses that are wanting to practice in practice longer. if that's what they want to do. So thinking of creative ways to do that. And so some hospitals are doing some amazing things on figuring out how to do that, maybe job sharing or, going back and allowing certain, positions to have lower number of hours per day versus a, 12-hour shift at the bedside. And then, looking at the younger nurses, we want this, honestly, to get into nursing in my opinion, is a calling. It's not a job. It typically pays well. It's high stress. There's a lot of things that go into it, but I would tell everybody I never regret in 31 years of being a nurse. I would tell my kids if they wanted to be a nurse, go to nursing school. My wife is a nurse and she actually teaches at a college of nursing. Nice. And so I would tell them, go into healthcare. It is incredibly rewarding. It is so needed. But some of the younger population are not interested necessarily in jumping into the bedside and doing 12 hours. They'd rather have some flexibility in their scheduling. So it is different.
Say it, Mark. Work-life balance, right? I mean, I got to tell you, like, we're dating ourselves, but like in the 90s when I went to college, like nursing was like so hot. Like nursing and education. One of them two, you're getting a job. Especially like I know at the time there was male nurses. They needed like, a flux of male nurses at, in the 90s. And, now it's balanced out, but it's like, it was like a hot thing. And now I think sometimes maybe you can speak about this. A lot of RNs now, you can do an accelerated program and get done in like 16 months to 2 years now?
Yeah, they've got a lot. I mean, it's so different. And the government's doing a great job about trying to help drive additional nurses coming out of school. So I do get the benefit of hearing a lot of it because my wife works in academia. So they are looking at opportunities. Are there ways, accelerated BSN programs where if you have another degree and being able to hop in and get your bachelor's, them counting some of those credits as dual so that you're not spending as much time in school. For many, many years, the bachelor's degree, was what a lot of hospitals were requiring. And you're recognizing that that's 4 years you're waiting on somebody to get into the workforce.
It's a long time.
So why can't we consider, an ADN, an associate degree nurse? That's how I started as an associate degree nurse. And you can come out in 2 to 3 years with an associate's degree and get them in the workforce earlier. And then, train them up and encourage them to get their bachelor's or go on for an advanced degree. That anything we can do right now to get more nurses into the practice areas is key. And so universities are trying to tweak how they do enrollment. They're trying to drive up numbers of students that are getting admitted, but then that's more college professors you need, and that's more clinical sites that you need. And so then there's some systems problems they run into as well. So yeah, it's a big deal. It's a really important initiative going on right now, is getting more nurses in the industry.
You know what we talked about earlier this week is actually, and it was a good idea. I forget who brought up. I think Suzanne did. It was actually having the hospitals have their own education. And then, and once you get in, you do a 2 or 3 year stint, plus these bonuses now, not to bounce around, but my friends, I mean, there's some big nursing bonuses like out West in Arizona and stuff like that now if you commit. But I think if a hospital needs a lot of nurses, why not have the school right there?
Absolutely. Yeah. If you're working in an academic hospital, it's most of the time, a lot of those are affiliated or associated with a university, like a nursing program. So a lot of those are kind of feeders, right? And they choose to go elsewhere sometimes, but it's an automatic feeder. If they've done some of their training there, they may say, oh, that's where I want to work. But yeah, if you go into a community hospital setting or something that's not associated with a university, it is important. You do have to figure out how to get them in. There's a hospital that I'm aware of that actually partnered with a university and gave some money to them and actually, committed to saying you can do a certain number of your clinicals here in our organization, and supported each other, kind of like we'll scratch your back, you scratch ours,
of course,
those types of things. But partnerships are key, right? But sometimes some places are a little nervous about doing that. You don't want to put all your eggs in one basket. So, I think here in Kentucky, we're blessed with a lot of nursing schools. And so it's amazing. And I can name like 6 to 8 of them right away. And they're all great quality programs, but students have a choice on where they want to work. So that's the other piece is, even if you go to nursing school that's associated with a program that a hospital endorses, that may not be the hospital where you want to land when you graduate.
No.
So I think just educating the students, letting them know what their options are, encouraging them, getting out there. Just what I had the opportunity to have are people who poured into me and kind of got me bit by the bug of what I wanted to do. Had I not had that, I may have stumbled around and looked around trying to figure out what I wanted to do too. But they poured into me, they invested in me, and I think that's key in nurses now is take people under your wing, support them, encourage them, answer their questions, invite them to your house and have dinner, answer their questions. We do that sometimes with students. We'll have them over for dinner, or we'll meet up with them somewhere and have coffee and just answer their questions. They
Q&As,
don't
man.
know what they don't know.
Q&As are the number one thing. I do it with Gen Zs all the time down here on the campus. Q&As, just quiz me. 30 people. Just have a BS chat. What you want to know. And I think the big thing with that's retention, right? For the hospitals. I mean, if you get somebody in there and you can listen to what they're complaining about or what they should change, I always say your front line are the best ones to tell you what to change. I mean, they see it every day.
You bet. And honestly, as a guy in nursing, even more important that I spend that time in investing in other guys that are interested in nursing, because we still need more men in nursing. I mean, it's still,
oh, wow, I didn't know that.
Still an initiative. I mean, there's more in it than were in 1994 when I came out. I walked into the room to take care of a patient and family members automatically call me doctor because I'm a guy. I'm like, no, I'm a nurse.
Are you kidding me? Wow.
So, yeah, I mean, definitely 30 years ago, I was automatically assumed to be the doctor because I was a guy walking into the room.
Yeah.
And, we would educate them. And there were a few guys that worked in our unit, exceptional nurses, and there are more, but definitely males are still the minority in nursing. But that's the onus on me as a male nurse to invest in other guys and help to encourage them into going into it as well.
Man, good stuff. Okay, brother. So now you come to this side, the recruiting staffing side, So I got to ask you, Mark, what made you come over and say, hey, I'm going to be part of the Healthcare Staffing Association?
Sure. Yeah, no, I got friends who are like, what are you doing? Like, what made you decide to do that? So it's a great question. I had the opportunity to work with a ton of different nurses and clinicians, rad techs and respiratory therapists all across the board that were travelers in the different jobs I've had in the last 10 years. 30 years, a nurse that I worked with in the emergency room setting in a small hospital was a traveler. 30 years ago when I was a brand new nurse, I was like, man, that would be cool someday to do that. And my wife and I kidded about maybe going to travel together, and it never came to fruition as nurses. But jumping into this was the opportunity to work with folks that are interested in traveling. And as a nurse, I know where they are going. I know where they've been. So as a clinician, I can speak to their experience. I can validate it. I can understand what their hurdles, their hiccups are, their concerns, because I'm, moving from home and, moving far away. I did that as a flight nurse. I moved from Kentucky to Georgia, knew nobody.
Ooh.
You have to integrate in. But being a traveler is not easy, right? I mean, you're going into a facility to help, to build a gap or to fill a gap in staffing. And so, I know what that's like as a leader bringing them in. And so when I was approached about this role, our CEO is a phenomenal CEO. I believe super, super strongly in our mission. But really, honestly, she was surrounded by several friends that just happened to be the same friends I have, and we had never met. And so when this opportunity came open for a COO, it also needed to be somebody who was a clinician, because we're Joint Commission certified. And so waited and talked to a lot of people, but just being able to make an impact in the industry, being able to help support nurses and clinicians that are going to the bedside, whether you work in the hospital or you're working the place that's providing them to the hospital, is so key. But really, honestly, I can bring the experience I've gotten operationally working on the hospital side. Man, they're under so much stress. Their margins are so tight on the hospital side too. Staffing is a thin thread sometimes in hospital settings as well. So trying to figure out how to help them meet that and use the experience I've got as a clinician, as a leader in the hospital, and how to help them on the hospital side as well. In staffing, this because you've done staffing for a long time. Sometimes people are, it's all about the money. Well, and many times it's not about the money. It's just trying to put somebody in a spot, trying to fill a hole to take care of patients.
Exactly. The money comes on the back end, Mark. I always say that for everything. Giving equals growth in everything in life, So you're totally right. And you know what I like about it real quick, Mark, is you've done that 30 years. And now you're in this side with the recruiting staffing. You know how to plug and play somebody because you know what kind of role it is. And I'm sure you're going to tell them, all the good stuff, but you're going to say these are the cons too, because you want to educate them and say, hey, you're going to be working 4 10s or whatever sometimes, and you're going to be, sleeping on your day off, till 5 in the afternoon.
Right.
I mean, people need to know that stuff too.
Absolutely.
You
Like
eat and sleep, you and your wife for all them years.
Absolutely. Like Suzanne mentioned, on Monday, it's key to take care of the people that are taking care of patients. That's what I've always said as a nursing leader. My whole job is to take care of the people that are taking care of the patients. And I had a great hospital president one time that had said, you take care of the patients and their families and each other, and the money and insurance and all those other things, it'll work its way out. I'm not worried about that. And just having as a leader, having that focus, and then using that even now on the staffing side with the people who are coming to work for us and that we're placing, or maybe they're out there in the markets trying to look at these different organizations. Who do I travel with? And saying, man, you want to travel with a company that's going to take care of you, that understands you, can have the conversations with you. You make a big splash somewhere and you have a problem and you're really having a hard time fitting in, or, the facility's not the right fit. How do you walk through that? And if you don't have a clinician to speak to and somebody that you can work with that understands it and helps you walk through it, it may be a total failure for both the traveler and for the facility. So it's key to set them up for success.
Dude, I love that. You got to admit, once you're in the staffing recruiting side, it's pretty addictive. You don't want to leave, man, right? It's a different ballpark, but you're still helping people. And that's the big thing is, your whole life, if you're a nurse, bedside, or you're in healthcare staffing, people to people, man, we're making an impact.
It is. It's a great industry. The people that our team that we have at Guardian is amazing. Everything from back office to recruiters, everybody's amazing. So they're totally invested. That's the one thing that I say is they're totally invested in the success of the team that they're putting places. But man, and once you're into it, it's so much fun, and the people that you get to work with are so much fun. It is addictive.
It is. Okay, so before we go, give me one nursing story real quick. Do you have one that pops to mind in 30 years, Mark? I mean, we could be here for 3 hours probably, but is there one that really touched people's hearts that you can throw out for a couple minutes?
Yeah, absolutely. I mean, there's so many. 30 years, it's so hard.
Oh.
I'd say probably one as a nursing leader at the bedside. There were so many. As a nursing leader, getting pulled in with a patient who's not doing well and his wife's really struggling, and they're there from out of state, and she's got no resources. She's got nobody to put a hand on her shoulder, to help her with making decisions. It's the brunt is on her. And so we really developed another nursing leader came and got me and said, hey, you're going to be getting this patient. And man, they've been in my unit for 3 months, and this is not going to be easy for her and for him. And so, man, I just came alongside, and she and I bonded and developed a relationship, and he and I bonded the patient. As a leader, I spent a lot of time in rooms as a leader over the years, visiting with patients and their families and talking about their care. But man, we bonded. And she would come and close my office door and, cry about bad news, or tell me about a grandbaby on the way, or, we got to walk through, recovery with that person. And then, unfortunately, at a point later on, walked through death with that person. But being able to walk through that with the patient's wife and with the family, just being able to hold a hand and just them confide in you. And really, honestly, I became a part of their family. And so it's super special. And we still keep in touch to this day, still have great conversations, and still we'll reach out with little messages here or there. So yeah, that's the key of being a nurse is honestly just being able to give your heart to somebody.
Dude, it's all about the hearts this week and every week, man. Stories like that, Mark, makes me tearful for joy and crying for sorrow. I mean, it is, man. It's good stuff. I'm so glad you're on the staffing side, recruiting side now. And before we go, let's give a shout out to, who, our sponsor. You ready for this?
Yeah, absolutely.
Advanced Partners. They put the FUN in funding. If you need funding, you need to call Advanced Partners. Shout out to them, man. They're the best. And I know you guys use them right now. So of course, they rock out. But before we go, Mark, one more, we gotta give a shout out here one more time. Thank you to all the nurses out there. I tell you what, I love you all. It's such a great week here. Hopefully next week, it's going to be bigger and bigger as we go on every year. But Mark, I got to tell you, the stories we talked about and your journey, I loved it, man. It was good talk today, man. I just wanted people to get to know 30 years of nursing. And I think you capped it, man, at the end with just loving everybody. And I can tell you enjoy what you do, man. You enjoy it.
Absolutely. And that's key for being a nurse, man, right? It's about people. It's about the patients we get to care for. So kudos to all the nurses out there. We couldn't do the work that we do without you. And honestly, the work that we do in healthcare, yes, nursing is a big deal, but all clinicians are important. But man, we just get to spend a little time appreciating nurses this week.
That's it, man. Well, hey, thank you so much, Mark. I'll talk to you soon. And all you nurses out there, we love you. Take care, guys.
Thanks. Hey, Richard.